closer to here.
Hi.
Yeah. So this is Maria Kropf, and she's amazing. She's an amazing Black mama, and so she's been through this world herself, which is really valuable information. Um, and she works for Multnomah County's Healthy Birth Initiatives, which is like an organization you can talk more about, but it's like specifically set up to deal with the disparities and the very bad outcomes that we're seeing.
Yes.
And you can take your breath a little bit, but I'm just happy to hear you maybe tell your background.
I made it. Yes, I'm actually gonna grab this stool because I'm gonna sit myself down. Yes. So kind of what Lily says. So I work for an organization called Healthy Birth Initiatives, and basically, the organization we focus on specifically Black birthing moms and families within Multnomah County. Our goal is to reduce the maternal mortality rate here in America, and then specifically here in Portland. Now, granted, the work that we do is just a small fraction of what needs to have happen because, unfortunately, Black women, Black birthing mothers are 3 times more to die in childbirth and also from postpartum complications. So our organization we have nurses and then community health specialists like myself. We essentially are an interim point base for mothers and during their prenatal, birth, and postpartum, and then we follow the kid up until they're 2 years old, because science and numbers show us that Black babies are less likely to make it to their first birthday here in America. And so our job is to make sure that our babies see past that first birthday. And speaking from experience, I was a mom within the program as well too. My wonderful case manager, Miss Winetta, got me through some tough times. Being a first-time mom. Kind of a little backstory. When I was 6 months pregnant, I was living in a maternity shelter. Didn't know what I was going to do, where I was going to be, but thankfully, from members of the community, I ended up staying with a family, giving birth when I was staying with them, and then finally got into my own place. And so, by me doing this work, kind of is coming full circle. Today, actually, the best example I can give to you of what the work that we do. Today, I met with a new client, and she's due the 26th of this month. She basically could pop at any second, but she looked at me and she said, I am grateful for you. She's like, I just met you, but she said, I can tell that this is something that you're passionate about. And she said, from one mom to another, she's like, I'm grateful that you're going to be able to be my case manager. And, later on, she told me, she's like, I'm not even gonna lie. She's like, I'm scared of dying. And that right there, it hurts. Yeah. And I told her, I said, it's a legit fear. It's a legit fear because in birthing spaces and in spaces in healthcare, it's not a friendly space for people of color. It's not. And so I told her, I said, this is why we do the work that we do, because we want to be able to be that second person outside of you going to your prenatal visits and baby well exam checks to check in with you guys, not only to make sure that you guys are thriving physically, but also mentally and socially, because we know that there also is a mental health crisis out here. Especially in community, low income and communities of color. Now, I think one of the best things I feel that our organization does is that we work with moms, no matter what your grade level and no matter how much income you make, because we know that racism does not discriminate against how much you make. And so we say that first and foremost, because some moms were like, well, I don't know if I can afford it. It does not cost you a dime. And so we provide moms and babies with resources from housing, food, mental health therapists, signing up and making sure that they have health insurance coverages for both mom and baby, getting them through postpartum as well too. Supplies, basic supplies, when it comes to mom and baby. car seat. We have a car seat program at a discounted cost. So moms that need a car seat and don't have the money, we can do it. The nice thing about that too is that we have techs that are trained to install the car seats for them. So they literally do not have to lift a finger to install a car seat. And then, so that's just, it literally is just one of the many resources that we provide to our moms. And, you know, every time we do a visit, we leave with a sense of, hey, I helped this mom accomplish this, or I checked in with baby and baby's looking healthy and everything, or I got, you know, I referred the mother to see a therapist and everything like that. So it's small, just small differences that equate to big changes, because we're seeing babies make it to 2, make it to 3. And then we have clients that will literally come back just like myself, and I will bring my child to work with me and say, this is exactly the product of the program that I'm a part of. So that's kind of just like an overview of what we do. And I am but 5 months into the position. The case management side is a little different, but being able to talk to moms is something that it comes naturally for me. So this is why I'm here. This is why I do the work. And it's literally like today, my heart is full. It feels really full. So that's just kind of just a brief general overview of, you know, what I do. So any questions?
Yeah, I have a question. Yeah. For referrals, if we were to refer to Healthy Birth Initiatives, would the person have to be pregnant, or could we refer someone who's already given birth?
So you can actually refer to somebody who's already given birth, which is also to a beauty thing. So if they've already given birth and they're interested in the program, all they would just need is a referral. And plus, the nice thing about it too is, even if it's just word of mouth to that mom, she can refer herself as well too, and we can take her in and everything. So that's kind of how the referral process works. And we work with a lot of the major hospitals here in Portland, and we have relationships with them to the point where we literally have sit down meetings like this with the OBs and the providers, and saying, hey, this is what's going well, this is what's what isn't working. And you know, having clients that delivered, we take their concerns or their complaints and bring them directly to the OBs, so they know exactly, hey, this is what happened with this birth, or overall, this is what you guys are doing well. And that's the one thing that I also like, is that being able to sit in those spaces and saying, hey, we're here, we're not going anywhere, and we're advocating for our clients, you know, at the end of the day, because that's what's important. Because, you know, one of the things that we teach is our moms advocating for themselves. And as we know, in healthcare, in general healthcare, doctors, OBs will spit big terms at you and clients, and they'll be like, oh, well, I don't know what that is, so I'll just go ahead and do whatever the doctor says. Whereas in a lot of times, the doctors, we would hope, would love to break it down in layman's terms for somebody to understand it, so that they can make an informed decision for themselves. I have a mom that is literally, she's about to deliver here in a couple of weeks. Her doctor, her OB said that because of the one time she had high blood pressure, they want to induce her. And I told her, I said, do your research first. I said, if your blood pressure is good for the next couple of weeks, and we provide blood pressure cuffs for each mom at home so they can take their blood pressure. And I told her, I said, if your blood pressure numbers remain the same, you know your body, and from a standpoint as a community health specialist and the standpoint of your nurse, there's no reason for you to be induced. And so with saying that to her and giving her information so she can make that informed decision, she told me, she's like, you know, she's like, I feel better, and just like my OB know that I don't want to go ahead with induction. And that happened to me as well too. The doctors told me, because I had gestational diabetes, I said, well, baby's head's going to be too big. We're going to need you to come in and have it induced. I was like, no, the baby's going to come on his own. Sure enough, he was born on his due date, no complications and everything like that. They did threaten me with trying to take me in for a C-section, and I said, no, they're not going to do that. So a lot of the big portion of our work is making sure, one, the moms are heard, and that they advocate for this themselves. Because sometimes, you know, a mom will, you know, her delivery date will come soon and she won't have time to get a doula, which we advocate that for as well too. We're in connection with a bunch of doula organizations here that we refer them to so they can get in touch. But it happenstance that they don't, we give them the information up front. We say, hey, this is kind of what to look out for, and this is what we want you to plan for so you can make an informed decision. So, but yes, to answer your question, referrals, if the mom wants to refer herself after she's given birth, she more than can. Or if organizations that see women of color, specifically Black women, they can refer them to us as well too. So there's no turning down a client or a mom or a family with us, and that's the beauty of it, is because we really want to serve these moms and make sure that at the end of the day they're making it through postpartum and their babies are making it. So thank you for that question. Yeah. Any others? Any questions? Yeah.
So how many? I have two questions. Mm-hmm. How many on average, like, you may not know this number.
Okay.
But like on average, like how many mothers do you happen to you guys happen to see? Because I know it's not as diverse as other states.
Yeah.
Oregon. So with that said, I was just curious.
Yeah. So so community health specialists like myself, we minimum we see about 25 clients. Now right now, for the community health specialists and the nurses, we're averaging about 50 moms. The nurses are averaging about 80 to 90 moms. So we have a literally full caseload, to the point where our nurses sometimes are booked out 3 months. But we're making it, but we still take the time for each and every client, and we still take in new referrals and do initials, and getting the moms into the program, making contact with them, letting them know, hey, this is what we can provide and what it is that that you may need to continue on through your pregnancy, postpartum, and then into childhood. So yeah, it's a lot of moms and everything, and and we're still always looking for nurses as well too, as well as community health specialists. But yeah, in general, it's, I would say, 50 to about 90 moms for each case manager.
How many case managers and nurses do you think?
So right now we have 2 community health specialists, and we have 5 nurses.
Okay,
So
small team.
Yeah, small team. And my boss is currently out on maternity leave with her second baby, and so when she comes back, she'll probably have to take on some clients as well too. So it's a small team, but we are committed to this work, and we'll show up by any means necessary for our moms.
In terms of I know you were mentioning OBs as some of the collaborative, you refer out and everything, but what about naturopathic midwives or midwives in general?
Yeah.
I'm just curious about it, because I know you mentioned also doulas for something that you guys also
So and right now, I don't think we work with any private midwives necessarily right now, but I know that that's something that we're always open to establishing a relationship with, because that's what we want to see. We want to see more midwives in the community, because it's we can refer our clients to midwives and saying, hey, you have more of, I guess, I would say, a calmer atmosphere for a birthing experience. Yes, we want you there. We want you there. So yes, the line for establishing that relationship is definitely open for us. So, yeah. I should have brought my cards. That's what I did. That's what I forgot. But yeah, thank you.
I have a question online.
Yes.
Yeah, so hi, Dr. Marchese. Would you ever let students come and shadow you and learn?
Yeah, actually, that's a good question. I definitely would have to check with, my boss and stuff, but I know that our organization is really open to letting the community in and saying, hey, this is what the work that we do, and everything. And, I would say, I feel like shadowing would be a definite to do. That's just something I would just have to check, but I think that we would definitely be open to it.
Okay.
Thank you.
Yeah, you're welcome. Any other questions? Yeah.
Do you guys provide any community events or things for mothers to have for a community?
Yes. Yes. So a lot of, for instance, there's a Juneteenth celebration tomorrow that's going on. We're actually going to have a table there as well too, and with that, we'll be bringing extra car seats, extra supplies to give out to pregnant moms and moms of the community. just as a way of saying, thank you, for being a part of the group. And then plus, in terms of connecting with other moms, we're working right now to form basically like a mommy meetup group, for moms to, with babies around the same age, to come together as a collective to support each other. Just because, as a mom and as a parent, sometimes it gets lonely when you're doing it by yourself. So knowing that you have people that are going through the same thing, it makes the load just a little easier. But yeah, we're definitely out in the community, and we do a lot of events. We do virtual childbirth and parenting classes as well too. We have a health educator that runs that. She was a case manager, and she's running that. So she's also too out within the community, partnering with other organizations. So there's a lot of outreach, not just for the nurses, but also for us. Like me coming here and speaking to you, this is outreach. So this is a lot what we do. So yeah, there's definitely things like events that we host for our moms to create community. Yeah.
Are there other organizations, like for those of us that might not practice in Oregon,
Uh-huh.
are you aware of like state by state or like county by county other organizations that practice similar
So
widespread?
yeah, I would say it's pretty widespread. I know that our organization, so we work under Multnomah County Health Department, and then with that, our organization to the umbrella is Healthy Start. So there's a lot of Healthy Start programs across the United States. Now, in terms of resources that are extensive and everything, they might have less limited resources like we do. But under the umbrella, Healthy Start has programs like this where they work with moms, they work with families that are, have babies to get them through, prenatal, birth, and then postpartum and through the stage 2. Yeah. Mm-hmm. Yeah. Any other questions?
I do,
Yeah.
or I wanted you to speak. I know you worked for child welfare before this, and you noticed that moms or children can be taken out of homes of Black families more often than white families. And so I was just wondering if you could speak a little bit about how your organization helps to minimize that, unnecessary interventions by child welfare.
Yes. So this is something that my boss, she had mentioned to case managers. So by law, working for Multnomah County, we are mandatory reporters. So if we see something by law, we have to report it. Now on that case, because yes, Black babies are taken out of their homes at a faster rate, what we do as the interim is if it's of course a safe situation, we'll sit down with the parent and we'll kind of say, hey, I noticed this. Is everything okay within the household? Now, if they gave us cues that, hey, I can't talk right now, then we'll say, hey, let's go ahead and meet somewhere safe so that you're safe. But we, as kind of like the interim to it, is that we'll, if it's appropriate and it's safe, we'll pull the family aside and say, hey, this is what I noticed, or I noticed this on baby, Jay or something like that. Is everything in the home okay? And if they say, no, something is going on, then from there we can say, hey, we can get you in touch with, some help, or maybe a caseworker from DHS. But what we want to avoid, having those babies being pulled out of the home, because that can do more damage emotionally to those kids. And that will leave emotional scars. So we come in, and if we see something and say, hey, what's going on? What can I help you with? What kind of resources can I get you to get you into a safer place, or to get baby the extra help that he needs or something, so that we can avoid pulling those babies out of the home. Now, granted, if it's something to where if as a case manager we're in the home and something happens that's drastic that we have to leave, yes, then we step in and say, okay, we got to get somebody from DHS down here, because our safety as employees are being put at risk, and then the whole house is being put at risk. But if it's something that isn't, extreme, we try to be that bridge first. We say, hey, what's going on? How can I help? What resources do you need? Because I said, we don't want to call DHS. That's the last resort. And so we just go in and we say, you know, where can we help? And the nice thing about it is that the relationships over time with our clients allows them to basically come to us and say, yeah, this is going on in my house. And it's like, oh, okay. It's like, yes, we peeped it, but we wanted to make sure that the client felt comfortable enough to come and talk to us and say, hey, I need help. I don't know who else to turn. I don't want DHS involved, but I need help. And so that's the beauty of it, is that we have those relationships with our clients and everything like that. And I had a mom where we did initial and we asked about the child's father involvement. And she was hesitant for about 3 seconds. And I looked at my boss and we both, there's something there that she hasn't come to us about. And 2 visits later, she opened up. She's like, yeah, I'm trying to get a divorce to get out of a domestic situation. And so by her feeling safe, she opened up to us and said, hey, this is what I'm going through. So we were able to get her needed resources to get her safely out of the home. So once again, a mom safe with her baby. So that's the goal.
Yeah. So you feel like if you can provide like some sort of plan,
Yep,
an intervention that you feel is like you can monitor,
yep,
and like will, you know, hopefully eliminate those problems, then it's not really necessary to do that the reporting because you're intervening.
Yeah, exactly. Just like DHS comes up with safety plans for their clients, we come up with a safety plan as well for our clients, to minimize that risk of, you know, the mom being in danger or the baby's being in danger. So, yeah.
Okay. And then are there common threads, like when you're like women are delivering or planning for that, like common themes of like where like pain is not being addressed properly or blood, or like you said, like unnecessary interventions? Are there like specific areas that you're seeing?
Yeah. Specifically with like one of the things that we're seeing common is with preeclampsia. Now, granted, I will say that as time has gone on, preeclampsia has been better monitored by OBs. However, for postpartum, that also still can occur, and that's when the OBs aren't there, and that's kind of where we step in and say, hey, you know, blood pressure is a little high, blurred vision, feeling dizzy, and saying, hey, let's get back in. But in terms of the birthing sense in the birthing room, yes, pain is still overlooked. Unfortunately, when a mom has pelvic pain, and saying to the doctor, hey, this doesn't feel right, they're cast aside and say, oh, well, that's just normal. Well, it's not normal when I'm bleeding profusely and the pain is getting too much that I can't speak, I can't talk and everything. And so we definitely see that it's still a common thing. And so that's why at every visit, especially postpartum and prenatally, we ask about pelvic pain. Are you feeling any pain? Is there any bleeding? And especially postpartum, because that's where, unfortunately, in the past and currently, where a lot of Black mothers lose their lives is postpartum. It's because it's not monitored by an OB. They're sent home with the baby and saying, oh, well, here's the baby, here you go, and good luck. But they're not given the tools to be like, hey, this is what to look for. And that's where we step in. We let them know, hey, expect to bleed for 6 weeks. Expect this kind of pain, but this kind of pain, don't ignore and get in touch with your OB. And once again, that goes back to the connection with the providers, saying, hey, you just had a patient that delivered, she's complaining of this, this type of pain, and she stated that she was pushed aside. And so then it's like, once we have those meetings with the OBs and the hospitals, we can say, hey, this department overlooked this. It's still, once again, it's a continuing problem. So
okay,
yeah.
We do have to wrap up for the online part. Is there any questions? Final questions?
Okay. I'll definitely make sure. Hopefully, I can drop a card to use to pass out to them and stuff. But once again, thank you guys for having me. Thank you for the time, and once again, thank you for being understanding, because life happens.
Yeah.
So I appreciate it, and I really do enjoy being here and just giving this talk. So thank you for the time.
Yeah. Thank you so much. Thank you for your work. And I think that being flexible with moms is one of the ways that we can make sure they get their voice in.
Yes.
Yeah.
Amen to that.
Yeah.